All right. Welcome everybody to Fear Factor 2025. Gonna let everybody get in a little bit. And looked like we had at least 200 people in the waiting room, so we'll let those numbers climb. Just a reminder, you are in the first episode of Fear Factor for 2025. We're going to be talking about Medicaid and Medicaid buy-in. And you are in a webinar, so we cannot see you or hear you. So you need to make yourself comfortable, whatever will keep you engaged with our wonderful panelists. Make yourself comfortable, and we will do our best to share the information that we have, knowing that everything changes all the time. So, okay, we're up to 227. That's good. I like it. For all of you that are coming in wanting CPDUs, continuing education, just remember that we will check you in the next 24 hours as long as you logged in with the same email that you registered with in Member Connect. Probably today is Wednesday, so I would imagine either probably by Friday you should have gotten an email that says that you can claim your CPTUs that will come from Member Connect. If you don't get that email, you can just go into Member Connect and look at my training list, and there should be a button that says claim my CPDUs by Friday. So you can do it that way also. And if you have any problems with it, you can email training at oacbdd.org and they will help you with it. Or you can email me, which is what most people do. So that's fine. All right. We're at 245 people. Remember, this is a Zoom meeting. There is, oh, I do need to check while we're in here. So I've left the chat open. I believe I want to make sure that the Q&A is available to everybody. I'm going to let you see all questions and let you upvote for those questions. So please pay attention to the questions that have already been asked. And you can, if it's the same question you have, you can just give it a little thumbs up. We will sometimes answer the questions. So look in the answered column also, because maybe your question already got answered. And if you ask a question that really doesn't have anything to do with our topical material, I'll answer it and put it in the dismissed probably. Or if you just say like, thank you by accident. The chat is also open. And right now, I'm going to change it because it was only allowing you to chat with the hosts and panelists. Now you should be able to chat with everyone. So if you want to just comment about what we're talking about, or you just want to say hi to keep yourself engaged, or you want to answer a question in the chat box, it should be good to go now. But if you want to ask a question very topic related, please put it in the Q&A and we'll work on those at the end. All right, I think that's it. Okay, we have a great group. Anne, you want to kick it off for us?
Sounds good. Hello, everyone. My name is Anne Tapia. I'm with the Ohio Department of Developmental Disabilities, and I'm in the Community Life Engagement team. I support Southwest Ohio, but there's a whole team of us across the state. Today, we are here for Fear Factor and an episode on Medicaid, including Medicaid buy-in and workability. So we're excited you all are here. Lisa ran through a couple logistics. We're going to run through a couple more here before we pass it over to our amazing team. We have an overview. We're going to start off with just some introductions and this logistics piece of it, and should wrap that up here shortly. We'll then move into the bulk of our time spent on the overview of Medicaid and Medicaid buy-in and workability, and we'll wrap up with some Q&A. So as Lisa said, drop those questions in the Q&A, and then we'll move on to our next steps. So we're going to kick off with a poll because we want to get a sense of who's here. It's always helpful for those who are presenting to know who's in the audience and make sure that we hit the areas that are most relevant for you. So Lisa's opening it. The questions on here, or the answers, I guess. What role are you attending today? The options include an SSA, Service and Support Administrator, another county board staff that's not an SSA role, family member, a self-advocate, a provider, someone from Opportunities for Ohioans with Disabilities, or if you're from the Ohio Department of Developmental Disabilities. If none of these fit for you, you are welcome to drop that in the chat. That also helps.
All right, I am going to go ahead. We're at 82%, so I'll share that out so you all know who's in the room today. Come on, one more person answer. There we go. We're up to 85%. All right, I'm going to end the poll and I will share the results out because I want you all to know who's here. So we've got 75% of our crowd is service and support administrator. Thank you so much. And then we have another 15%, which are other county board staff. We have 7 family members in the group. That's 3%. Thank you so much for attending. We have 2 self-advocates in the audience. And then, of course, we also have some self-advocates on our panel. We have 7 providers. That's awesome. Thank you so much for coming on. I know you guys don't have a lot of time. And then we have 2% of the people are from Opportunities for Ohioans with Disabilities. And only 1 cohort of Anns at the Ohio Department of DD is here. So when you look at the chat box, we also have some a payee out there, Ocali folks. Thanks for being here. Family members. So that's who is in the room today. If you are a family member or a self-advocate, or really a provider for that matter, any of those kind of underrepresented groups, and you have ideas of other places that we might be able to do this kind of training, we are always open to finding ways to share this information. We do have recordings, which we'll show you in a minute where to find those, but we would also be happy to do this training in a different venue or a different time that might allow for more family members, self-advocates or providers to join. So, all right.
Okay.
I think I go here, don't I? So
Go for
really,
it.
really quick, Fear Factor, we were just talking. Darenda has been with us since the beginning, as well as quite a few other people on the panel. And we were just talking about this is 5 years we've been working on the Fear Factor. And where did it come from besides a TV series that everybody watched a long time ago? It was actually with Keith Banner and myself from the Department of DD, along with Christine, really talking about what can we do to help people with their fears of working. Why are people so afraid? It seems to be like the number one reason, like I can't work, I'll lose my benefits. So we brainstormed what could we be doing, and it was during the COVID pandemic. What could we be doing to help get the word out and address those fears? And this really just came up with this acronym that with facts, evaluation, taking action will get results, and that results will be more people with disabilities working in the community and not having as much fear about losing benefits. So we've been working at this for 5 years, and people seem to keep coming back. So we're so thankful for the 291 people that tuned in today. And we will continue to do this as long as you keep coming. So, all right. Next slide, I think.
I was waiting for someone else to change it, and it's me.
Oh,
Sorry
you
about
were
that.
smiling. I was like, oh, she's got this.
It's me, my bad.
Uh,
So we've talked a little bit about this purpose. I just want to kind of call out because you all are here. The idea is to be a resource to you all who are here, the SSAs, the job seekers and employees with developmental disabilities, as well as those who are supporting people with disabilities. So thank you for being part of this. And I see all the accolades in the chat. And so thank you for your enthusiasm for this work. We are thrilled to keep doing it. I noticed that in the Q&A, there's already a question about getting this PowerPoint. And yes, we do drop this into the Employment First website, which I can drop in the Q&A and also in the chat, the link, or someone else can. The link to that. We include the PowerPoint, the recording of this video, as well as you'll see on here the link to the Fear Factor working document, which is where there's kind of a one-stop shop of some links that are helpful related to benefits and benefits analysis. So a couple episodes just to call out that have been done in the past that you can also find on that website include Stable Account, SSI and SSDI, Ticket to Work, as well as things like today, Medicaid Buy-In for workers with disabilities and reporting requirements. We try to go through that content and think about where has information changed or where might information change that this group then needs to make sure we're updating information. But you can, at the moment, see some of the archived information. We're looking to get that changed so that you would just have the most current information. And we've already done our shout out to all of you Fear Factor fans, but can't help but say it again since it's on the slide. So thank you for being here. All right. So how did we get here? We typically will pull you toward the end of each episode and ask you what is helpful. And so we like to make sure that we're staying relevant to the needs that you all have. I've mentioned we had a couple topics recently, and you can find those on the Employment First website. Okay, so we're going to dive into our second poll.
I didn't do that one. Let's just
Oh,
answer it in the chat box.
that'll work. So we want to get a sense of what you know. Can you give us a sense of how much you know about Medicaid buy-in for workers with disabilities and workability?
So you can name them 1, 2, 3, or 4. You've never heard is 1. I've heard of Medicaid and Medicaid buy-in, but I don't know much about it. 2 or 3, I consider myself fairly knowledgeable about Medicaid, Medicaid buy-in, and workability. Or 4, I believe I know as much as the presenters about this topic. And I will tell you, beware of saying number 4, because when you say number 4, we recruit you to become part of our team. So, and we have somebody that can testify to that today. So, very excited to see you. So we got lots of, let's look at that. So we got a lot of 2s. I see a lot of 2s, quite a few 3s, just a few 1s, not too many 1s, but a few. There's another one. I would say 2s are the number 1 answer. 3s probably a second there. And then I would say the never heard of it is probably the last. And then I see nobody saying they know as much as we do, which, well, those, I probably warned them off of that, and so they were like, yeah, no, that's not gonna happen. But sorry about that. I will get our poll working next time for our next session on this. We've got perfect. Yeah, I would say the 2s win it, and
I think so too. And thank you all for your honesty and recognizing where you are. I think that helps to lay the foundation for our Fear Factor superstars. So I want to call them out and begin to pass over the mic. So Christine Brown, who is from Nisonger, Darenda Geer, who has her own consulting agency, and Kim Bernardi, who is with Medina County Board of DD. We thank you all for taking the lead today. You'll hear from them in just a moment. But want to give a shout out to all of the folks who are kind of behind the scenes. We call them our production team that make it possible. So you see Paula Washek, who is with Clearwater Cog, Latosha Olinger from Warren County DD. Oh my goodness, I'm so sorry. It should say Libby
oh.
Grove. I didn't catch the other Elizabeth. They're both
Give a
Elizabeths
wave, give a wave, Libby. There you are. All right.
from the Butler County Board of DD. We have Nate Turner, and Darenda and Jeannie. I already said Darenda, Jeannie, and we've most recently recruited Margaret, who is joining
Yay.
our production team as well. So thank you all for being part of this good work.
That's right. Yeah,
And
we're
with
always looking
that,
to get more people. So love it. All right, so we're going to get before we get started, hey, we're right on time, 1:15. Look at that, Anne. Just to answer a question again about the CPDUs, there's nothing you need to do. You are logged in and you will receive an email from OACB Member Connect, or starting on Friday, you can go into OACB Member Connect to claim your CPDUs. If you have any problems, I'm going to put an email in the chat box for you to email that. All right, let's get started. And anybody who's not presenting, if you want to turn off your cameras, then that'll give more room to the screen for those guys. I'm going to stay on for moral support, and maybe Anne will too,
Yeah.
so we can just. All right.
Okay, so I'm Darenda Geer from I have my own consulting business as they said before, but I worked for Fairfield County Board of DD for several years, and that's how I got into all this. I welcome you to this bright Ohio sunny and finally a little bit warmer day. Glad to be back. So let's get into the meat and potatoes of why we're here. We're going to be talking about Medicaid, in the different parts of Medicaid, a little bit about waivers. We're not going to go into too much of that. And remember, you can go ahead and go to the next slide. Please remember when we go through this that you don't need to become the expert. You don't need to remember every single thing that's there. These presentations are meant as information guidelines to perk your brain, if you will, on things. You can always reach out to someone who is considered an expert in the field to get more detailed information if needed. All right, so what is Medicaid? So Medicaid, and I don't read the slides word for word, but Medicaid is basically a federal state healthcare program. It's a federal program, but each state has the right to change it up, if you will, according to what best meets the needs of their state. It's a healthcare assistance program. It predominantly serves low-income people of every age. Individuals usually pay no part of the cost of the covered medical expenses. Eligibility is based on income and asset levels. If an individual receives or becomes eligible for supplemental security income, SSI, under the Social Security Disability Program in the state of Ohio, they are automatically eligible for Medicaid. You also may be, you don't have to be disabled to be eligible for Medicaid. You have to be aged, blind, or disabled. And again, you have to have a financial need. It's a means tested program. Sometimes beneficiaries who are newly eligible for Social Security Disability Insurance and not yet eligible for Medicare, which is a whole nother thing that we don't want to even get into today, they too can be Medicaid eligible until they become Medicaid or Medicare eligible. And typically there is no cost to the beneficiary unless enrolled in Medicaid Buy-In for workers with disabilities. Next slide, please. Okay, so there is what I call a misconception about Medicaid. People think Medicaid is Medicaid and there's one plan. I'm here to tell you there is not. There are multiple types of Medicaid programs. Each program has different income eligibility. Most of them have the same asset eligibility, but they are all dependent on what you're certain, or that your beneficiary, the person you serve, what their criteria allows them to be eligible for. So some of those, and we are not going to go into all of them today, but we have what's called regular Medicaid, standard Medicaid, ABD, age blind disabled Medicaid, modified adjusted gross income, Magi adult or Magi child Medicaid, Medicaid Buy-In for workers with disabilities, or Ohio Workability, which is a new part or an offshoot to the MBIWD program, if you will. MyCare Ohio, which is an integrated delivery care system waiver, actually. And we'll go into that a little bit later on as well. Ribicoff Kids, these are typically for children who are in foster care, and we're not going to go into any of the details of Ribicoff today. Parents and caretakers of relatives can also possibly be eligible for Medicaid. Ohio Healthy Start, which was formerly called the CHIP program. Then you have Medicaid Home and Community Based to Service waivers. Waivers provide services, not health care. And there's all types of waivers underneath that program. And again, we're going to only skim the topic of waivers today. But this just gives you an idea of, Medicaid is not just Medicaid. Okay, next slide. Let's dig in. Okay, age blind disabled Medicaid. What is that? A person must be age 65 or older, or considered legally blind, or have a disability that meets the definition of Social Security's specific impairments, and they have to meet the income and resource requirements depending on the state of residence. In Ohio, the Medicaid financial eligibility is based on what is called the Supplemental Security Income, SSI, federal benefit rate, or F.E.A.R. This year, in 2025, and it changes every year, that federal benefit rate is $967 for an individual, $1,450 for a couple, and that's gross countable income. Not all income is counted. For this Medicaid program, the resource and assets, they're both one and the same, must be under $2,000. That hasn't changed in a bazillion years, and I believe there are some people out there lobbying to get that changed, but as of today, it is still $2,000 for an individual, $3,000 for a couple. The state Medicaid covers basically inpatient, outpatient hospital care, physician services, x-rays, tests, pretty much everything. If you're in Medicaid, pretty much everything is going to be covered. Also, it can provide, like with MyCare Ohio, it can provide case management, which helps put everything under I can't even talk today, one umbrella. All right, I also put, or we put on the end of the slides at the bottom, the resource, if you ever need to go look and read all of the ins and outs of a specific type of Medicaid, you want to go to the Ohio Administrative Code. So the resource for that, which is at the bottom of this slide, is listed. Next slide. Okay, so a person may not have income that is below what we previously talked about, the 967. So in that case, maybe they qualify for what's called modified adjusted gross income, MAGI Medicaid. There are different categories of MAGI Medicaid because it's not easy. They're not going to make it simple. This is all very complex. So MAGI means it fell under what's called Medicaid expansion, where specifically in the state of Ohio, Medicaid increased the income level for certain people who still needed Medicaid but didn't need ABD. And what they do is they go by the modified adjusted gross income of the particular person or household that is applying for the Medicaid. Who's potentially eligible? Single, childless adults, married, childless couples, families with children under 19 or age 19 and under, and then children up to age 19. And you want to know what's the income guidelines? Well, again, you don't have to be the expert, and I don't think my mouse is working, but over to the right where it shows a chart. If you look down the left side, this is the Medicaid household size. Across the top is a different type of potential eligibility income thresholds. So for example, a parent or a caretaker has to meet 90% of that income threshold. An adult who may be eligible for MAGI expansion has to meet 133% of the federal benefit rate, and so on. I'm not going to go through each one of those. But these are the income levels, and people that are in the field that I'm in, we use this religiously to determine someone's eligibility for a specific type of Medicaid, in this instance, MAGI Medicaid. Okay. And again, at the bottom is the OAC resource. You don't have to go back to that one. That's fine. Thanks, hon. So Ohio Healthy Start and Healthy Families. Again, this was formerly known as CHIP, Children's Health Insurance Program, and it's still called CHIP by many JFS agencies. But Ohio Healthy Start provides a free or low-cost health insurance for families with children. The program is designed to provide increased access to health coverage for children and family. Again, a person may not meet a certain type of Medicaid healthcare eligibility, but maybe they meet CHIP. What's the eligibility? 18 years of age and under, and or a primary caregiver with a child or children 18 years of age and under, must be a U.S. citizen, national, or non-citizen legally admitted to the U.S., and uninsured, which means ineligible for any other type of Medicaid. And then to the right are the maximum monthly gross income levels to be eligible for this program. And you can see those are much higher. And then at the bottom is the resource, and I put in this resource is the Ohio Revised Code resource for CHIP as well. Next slide. And I believe I'm going to turn it over to Kim Bernardi at this point so she can discuss MyCare Ohio.
Well, thank you, Darenda. Hi, I'm Kim Bernardi. I'm with Medina County. And we're just going to talk a little bit about MyCare Ohio, which an individual must be Medicaid eligible and Medicare eligible. And MyCare is a managed care program designed for Ohioans. The program integrates Medicare and Medicaid benefits into one coordinated by a managed care plan. The eligibility is, again, you have to have both Medicare and Medicaid services. You have to be 18 or older and reside in one of the 29 counties where MyCare Ohio is currently available. Now, come January 2026, things are changing a little bit. From MyCare Ohio to the Next Generation program. There is going to be an age difference. It's going to be 21 years or older instead of 18 or older. Okay, and with this, also back to the MyCare Ohio, but it's going to be the same for the generation. You're going to have one care coordinator for both your benefits. So there's going to be one organization responsible to help you with your benefits and combining both the Medicaid and Medicare and make it a lot simpler for you. Next. And I believe this is Christine.
Yes, thank you. Thank you. And I want to tell you all about this. Medicaid Buy-In was passed in 1997, I think. And the thing is, it's been around for a long time. The program, like it says, is made for people 16 through 64 for the Medicaid Buy-In, and being the same goes for being a U.S. citizen or a legal non-citizen, okay, and an Ohio resident, and having the disability defined as Social Security, working full-time, part-time, self-employment with which state and federal income and payroll taxes are paid or withheld. And so they can meet the criteria, and they need to show they're not eligible for any other program. And in the new thing, the Ohio Workability, that thing took 9.5 years to get done. Because first, when they made Medicaid Buy-In, the retirement age was 65. Today, we're 67, and the federal government's trying to change it to higher. So we said, let's get this new age group added, because we don't want people to quit working and paying into taxes. And so we fought, and everything is mainly the same in eligibility, except that there isn't a minimum number of hours. You only have to be doing 1 hour a month to stay in this group, versus there's at least about I don't want to say 20 hours a week, but they make it less hard, and like working with no specific employment requirement. And you still can, even if you're in this workability, you still can have your long-term service and supports. So it's very similar and having the same coverage. But we had this because I had friends who were at risk of having to quit working and had cases of people being charged when they turned 65, and that was just age, disability, and employment discrimination, which led this to the front fire in the legislature. Next. So, like this financial eligibility, they have like where the net income is up to 250% family federal poverty level for this family size. And as of this year, up to $3,260.42. They have several disregards, and there is a $20,000 earned income disregard. Earned income is wages. And then they have also, for financial eligibility, the 15,210, and only the individual's resources is counted. So and here in the workability, they do this family net income, but it's just really the individual, if I'm correct, Darenda. And then,
Sorry.
isn't that correct that they?
No, an individual is eligible for MBIWD based on themselves, but the cost of the premium is based on household income.
They say the family size. So what if there's a family of 4?
Then you use the percentage of the federal poverty level for a family of 4.
Oh, okay, sorry.
Okay.
And so the individual's net unearned income after disregards being less than or equal to the SSI or residential, that's trying to be so they get close to the asset level for Medicaid, but the resource is still the same, 15,210, and only the individual's resources are considered. Next. So this is the game board that is designed. We can go through this because what this does is it gives a way to see if you're eligible. Next slide. So being able to see, like, are you 16 through 64? Now they are gonna someday change this and add 65 and older in a different one, okay? And then going down to, do you have a job that pays into regularly? And if someone said yes, you'd press continue. If no, then you're not eligible. Do you have a disability that meets the standard SSI or SSDI? There's yes, and there's no, but there's a way that you could be eligible under certain conditions if the Social Security and JFS work together and ask for the disability documentation. And like it says, the income and counts unearned benefit, other income, Medicaid does not count $20, and earned Medicaid counts gross, and they take out $65, and then they also divide by 2, and there's other work impairment related work expenses to make that counted even less. And then you ask, what is their monthly income, and then they follow it and go up to paying 10% usually of your income, 10% premium. But this changes every year and we update this. Next. Next. Okay, sorry. So this is the calculator sheet, and like, resources that don't count, stable counts, the home you live in, or one vehicle you own, term life insurance pass, which is planned to achieve self-support, and this burial account. Go back, went to, go back, please. You went too far. Can someone please push it back? You went too far.
I did. I think it was just on a delay. It should show up again.
Okay, sorry.
Looks like Ian's trying to figure that out, Christine. Hold on real quick. There we go.
Sorry.
You want, Christine.
But then, like, what they count is cash, checking and savings, certified deposit, the whole life insurance, cash value, items that you own that can easily be converted into cash. So it's contact JFS and ask them to apply for other deductions included, like the $20,000 Medicaid Buy-In deduction to determine your eligibility. Because if you seem over, but they didn't apply that $20,000 disregard, then probably you would be eligible. So also trying to show all kinds of impairment related work expenses, like for only 2 examples, health insurance premiums going out of your paycheck, or transportation you're paying out of your pocket. I won't go into all of that, but I just wanted to say that. And those are the income levels for the 150% federal poverty level. If you are over that, they first take the dollar amount, then subtract the 150% federal poverty level, and then living in your home, and then multiply by 10%, then your premium. Next.
I'm gonna jump in really quick, Christine.
Sorry.
No, you're doing great. People are like asking a ton of questions and all that, so it's all good. Are you still talking more about the Medicaid buy-in? You still?
Yes.
Okay, I'm gonna wait just so you guys all know. Check the answered questions, because people are asking a lot of questions in the chat box, and our panelists are very efficient in answering them. So make sure you can read those, and then we will touch base before Christine's done with a couple of them. Go ahead, Christine.
Okay, so this is a guide where you can find information about Medicaid buy-in and other resources. And you can also contact our benefit consultants for support. That's it.
Sorry, I was too excited to talk, so I should have given you some time. I just want to go over a couple of the questions that have been asked before we go to the next topic, because like I said, some of them have been answered. I think the number one question everybody keeps asking is, how do I apply for Medicaid buy-in specifically?
Okay, so yeah, so like I answered this on the Q&A, but they probably didn't see it. So you apply through Job and Family Services. You can go in person, you can call them and do it. Forms that are required are JFS 07200, ODM 07211, and ODM 07236. I want to caveat that with not every county JFS requires people to use the same forms, but the JF 0720 0 is absolutely required. If a person already has a benefits through JFS, they can apply through their benefits.gov portal.
Okay, thank
I
you.
saw something here from this Rachel, and somebody down below says, Rachel, we were told the same thing.
Yeah, there's comments. Remember that if you have a specific question, you put it in the Q&A, and in the chat, I do see some folks putting in some stories, which is fine. I totally get it. I think the other important thing before we move on, I really want to address is there's a couple people kind of saying, how many hours can I work? They really just want that simple answer, right, Darenda and everybody? This is what we've been talking about for 5 years. Everybody wants a simple answer of how many hours can I work and keep my Medicaid. So let's just take that question on really quick, Darenda.
Okay, so it's not about how many hours you can work. It's about how much is your countable income. So when I'm working with clients, I will give them different scenarios. You can work 20 hours, making $12 an hour. It comes out to this average gross monthly wage. That makes you eligible for A, B, and C. So to tell a person that we serve or a client or whomever, oh, you can work X hours is too general. You have to know how many hours per week on average do they work? What is their hourly wage? Then you have to compute that by 4.333, which is the average weeks in a month. I mean, it's just a little bit, it's not complicated, but it's more than, I just can't tell you can work 10 hours or 12 hours or 30 hours. I've got to know what the financial is behind it.
Right. And it also depends on what kind of, I don't know, you guys know those words, right? There's different programs that will give you money off of that, that you can make a little more. So it is not a simple answer. We wish it was a simple answer, but I'm going to be honest. The worst thing you can do is to tell somebody and make it simple. You really can't. What you need to do is reach out to people who understand, which are going to be your benefits analysis folks, or people like Darenda who run companies doing this for folks, or some county boards hire them. So we're going to have another session in 2025 reminding everybody the importance of, if you want to work and you're using Medicaid, you really want to get a benefits analysis. That is the number one thing. That was the last thing we talked about in 2024, because every story is different. We have stories of people that only work 15 hours, but they make enough per hour that it causes problems. And then we have stories of people that are working 40 hours a week who still have Medicaid. So no easy answer. I wish there was. All right, we'll keep moving. Thank you.
Maybe for all the benefit consultants, maybe you might want to put your emails in there for the people that are having wrote, and then they know who to contact. I just thought of that.
Yeah. Yep. All right. Who's taking over? We'll keep monitoring and have more questions at the end.
I think this was Darenda, unless
No.
I'm wrong.
No, this one's me.
Oh, sorry.
All right, go Kim.
All right. So now we're going to talk about Medicaid waivers. Typically a waiver, just allows to provide, home and community-based waiver services such as homemaker personal care services, non-medical transportation services, delivered meals, technology, things like that. However, one must be Medicaid eligible in order to receive a waiver. Now, somebody may not be Medicaid eligible unless they're receiving a waiver, because if they're over the $967 a month and they don't qualify for MAGI or any of the other benefits, the waiver could possibly make them eligible, because there is a Medicaid needs allowance for the waivers, and it's $1,886 per month income. So then there's a $65 disregard when they're calculating that, which we'll get that to in the next page in a minute. Minors who receive waivers, their parents' income is waived. So the minor would be eligible for the waiver and the Medicaid. All right, so can we go to the next page, please? Also, somebody on a waiver has to also meet the level of care for the waiver through DODD. There we go. Okay, so somebody who has a waiver and they're not in the Medicaid Buy-In program because they're not working, and their income is over the $18.86 a month minus the $65 disregard, they're going to end up having to pay what's called a patient liability. And they have to pay the patient liability to one of their providers. And the provider agency has to be deemed the one receiving it, because then when the provider bills, they're going to receive less from Ohio Department of Developmental Disabilities when they bill for that same amount. Then a patient liability can be alleviated if the individual is eligible for Medicaid 1619B, ABD Medicaid, MAGI, or Medicaid Buy-In. Now with the Medicaid Buy-In program, so if somebody's working and they have a patient liability and they're paying, say, $200-300 a month patient liability for their waiver and they're working, they're going to want to get enrolled in the Medicaid Buy-In program because they're most likely going to pay a lesser premium for their Medicaid based on the calculations. So if somebody's working and they have a patient liability, they're going to want to contact their local Job and Family Services and let them know they're working now. And Job and Family Services can put them in the program and apply for the Medicaid Buy-In program for them. Okay, next page, please. Okay, this is just an example of a patient liability calculations. Okay, so this person earns $1,200 per month gross from employment, and they have $1,348 from their unearned income, which would be Social Security benefits. So totaling $2,548 a month is their income. Remember, the Medicaid needs allowance is $1,886. So they take the $1,886, subtract it from the $2,548, and it comes out to $662. Then there's a earned income exclusion of $65. So the remainder is $597. So in this scenario, this person will have to pay $597 a month patient liability to one of their providers. Thank you very much. Next slide is, I think, Darenda.
I think so.
I think Ian's trying to move it to the next
There
slide.
we
She's got a delay.
Okay, so as you can tell, this is so complicated. It really is. It's Medicaid itself is, Medicaid waivers are complicated. We've been doing it for the years, still don't know it all. What's the bottom line for you? What's the takeaway? When an individual says they have Medicaid or Medicare, that's a pretty general statement. But they should know, or their family or their caseworker or their provider should know what type of a program that they're in, and they can get that information easily by contacting, JFS or a benefits analyst or someone else. It's not easy for people to understand all this, and again, this is just a guideline for you to have top level information. If you need more detailed information, you need to reach out. There's also the following agencies that can help individuals and others determine the type of plan the individual is enrolled in or what they may qualify for. And that, of course, is Job and Family Services for the Medicaid, Medicare Savings Program, which is also called Medicare Premium Assistance Program, Ohio Senior Health Insurance Information Program, OSHIP, that's Medicare and Medicare Savings Programs as well. Central Ohio Area Agency on Aging, very, very good with waiver information, Medicare.gov, Medicaid Ohio, and of course, certified work incentive practitioners are people you can reach out to for help. Next slide. Should be questions, I think. This is lagging today. I wonder what's going on.
Yeah, I think that Anne's having some issues and she's sharing the slides and she changed
Okay.
them. So we there we go.
Okay, so questions. Questions are the path to learning, and no question is stupid, if you will.
Yeah.
I tried to answer as many as I could when we were doing it, but I also wanted to pay attention. So I don't know. Lisa, do you want to read them?
Yeah, let's go because you guys were so fast answering some of them that I think some people might not have caught them. So let's start with there's an open question right now from Shelley, and it says, what is the reason some individuals pay the provider while other individuals pay the state for the patient liability? This sounds like a Lisa question, by the way. I think it's probably because we're thinking of two different things, by the way, but that's okay. Go for it, Darenda.
Well, myself or Kim. Kim, do you want to address this one?
Well, it's actually, they pay the state for their Medicaid buy-in premium. The patient liability goes to a provider unless there isn't a provider.
Yes,
So,
and
so
I've
that might
always
be what
gotten
the
those
confusion is.
confused.
Mhm.
Yeah, no one's paying the state for the patient liability they incur.
Correct. It's the
That's out of
Medicaid buy-in premium.
Yeah, it's out of pocket. Patient liability is out of pocket money paid to a specific provider for billed services over a specific threshold.
Mhm.
So Shelley was asking, could you have to pay both of those potentially?
No, because if you have a patient liability and you're working, they're going to put you in the Medicaid buy-in program.
Although
And
they
then
may
even
not
in the
automatically,
Medicaid buy-in program, you may not even have a premium based on the calculations.
but know that being placed in MBIWD is not always automatic in every county.
Right.
Yes, you have to.
Okay, I'm trying to get rid of a couple of these so we can see what else is coming in because people are just bringing them in. Stacy asked for Medicaid individuals can only have $2,000 in assets. What was amount they can have in assets if they are in MBIWD?
15,000 and something.
There was
15,000
15,000 and
210.
210, and that adjusts every year, that they based on the cost of living adjustment of Social Security is what they do.
Another good thing is a stable account. So anybody can put money into a stable account, and that doesn't affect their assets whatsoever as far as their benefits.
Well, not anybody.
Well,
they got to be over a certain age and they have to be disabled.
Yeah, we have a
Yeah,
whole
but
we have a
some-
recording
what-
about stable, so we
sorry.
can refer people to the stable recording, and we
Right.
always we redo those every 2 years. But it is a good way that if there are assets that people qualify for stable, that they could put money in there.
I can say one thing that people only talk to me on, and sometimes I double check with Darenda or others. Some people wonder if you put your wages in the stable account, does that mean it's not counted? No, it's still counted. I'm
Yeah.
pointing out that some people think, well, you say it's not counted, so I guess my wages wouldn't be counted. But that is not true, just so you all know that.
It's true. Absolutely.
Correct.
So Valerie was asking if the person doesn't have a provider for a time period, are they still required to pay the patient liability? And if so, to who?
They wouldn't have a patient liability if they don't have a provider because services are not being rendered.
I think the dilemma that we've seen, and I mean, this is I'm loving all the questions on patient liability. This is one that we haven't specifically taken on, and it probably is a bigger conversation than we can answer within all of this. But I do know that there's times where the patient liability, it's been difficult to find a provider, what the person, I'm going to say it wrong. It's been difficult to figure out what provider we can collect that from, especially in self-directed waiver services. It's gotten a lot more difficult sometimes. So I'm going to say on that one, the question is still out there. And we know you need more information about patient liability, and we'll definitely try to, but I would definitely work with your county board. Well, you are the county board, Valerie. I know who you are. Yeah, I can link you with some other people actually that are on this call. I think Britt McGuire from Claremont has been very involved in helping people figure out the patient liability. And Valerie, I can give you her email to talk to. So I'm gonna put that one off. And what else we got? I love Miranda's question. So I'm a little sarcastic, everybody, okay? It's only because I truly realize what a complicated world we live in. But can we get a decision tree with all of this info with explanations? We're trying. That's all I got to say. Yeah, this is so complicated. And that's why there are these certified work specialists, work incentive, work benefits analysis people, because it really has to be looked at the individual level to consider everything every single time. There's no easy answer. That I think that game board's about as easy as it gets, and I know y'all were really excited about that game board, but I believe that it's not necessarily even available online. Is that what somebody wrote in the? There has to be.
Well,
I don't think it's available online.
I don't think it is, but I think they're gonna update it in the Ohio Employment First website. They had the old version, not
Right.
2024 numbers. We haven't gotten the 2025 one up there.
Yeah.
Those updated.
Lisa, could we, because I have it as a separate handout.
Mm-hmm.
I send it to you and then you send it out with the presentation possibly.
Absolutely. Yeah, that'd be great.
Did with this episode as well.
Yeah. Okay, so Demetra is saying, so to clarify, if I have someone over the age of 65 and still working, they are not eligible for MBIWD, so they have to pay the patient liability.
No, that's not correct, because now that we got the Medicaid workability category added, they would be switched and you'd be speaking to the caseworker and saying, hey, my individual now turned 65, so can they go to this workability? They don't have to go for the patient liability because they continue to work. So that's why I said it took 9.5 years to get this. But the thing is, don't quit till it's done. So please know that is still fairly new. And so we have been saying whenever anybody is almost turning 65, we are planning to put in like path to employment and so on. We're going to be trying to put in check marks like you have are you wanting to work? Have you checked out Medicaid Buy-In, or if they are 65 and older or turning 65, are you checking into having them get enrolled on workability? Having that for all the SSAs would make it so much more simple because you just have check marks. And so we're working on that because then it would be much more simple.
Yeah. So the quick and easy answer is that at 65, they're eligible for workability. And you
Yes.
you have to advocate through that. But that is a new program. And when they called it workability, that didn't make any sense to me. I am like literally, when you guys were all talking about it, I'm like, what do you mean? But up until 65 and you're working, you've got MBIWD, and then it should be switched over to the workability program. And that is absolutely, Christine has been instrumental along with some of her other advocates in getting that going. So thank you so much. All right, we're going to keep going through these questions. You guys got this. All right, and Margaret, Paula, Latosha, any of you guys just jump. Libby, we've got our panelists here. So Robin says that in Warren County, there's a new situation. Whoop, you just answered it. Okay, panelists, they're answering questions so fast that I can't even, I can't ask it. But since I started, I'm just going to go ahead and say Warren County sees individuals show SLMB at, oh my God, they just moved.
Specified low income beneficiary.
Is it it is a program that helps low income Medicare beneficiaries. Can whoever answer that explain that for everybody? You don't really have to, since we're actually going through the questions, let's stop doing.
Yes, somebody who's Medicare, Medicaid eligible, Medicare has a monthly premium. I believe it's $185 a month right now. It comes out of your Social Security check. However, if you're on Medicaid and you meet certain requirements as far as income, Medicaid can pay the individual's Medicare premium. So
That's
SLMB
called-
is one of those, and that covers premium B. And then
That-
there's QMB, which is a lower income rate, and it covers AMB and also some copays and deductibles.
Yes,
called the Medicare Premium Assistance Program.
right. It's MPAP, or Medicare Savings Program. Without getting into too much detail, Lisa and everybody, there's 3 plans. There's 4, but no one ever pays attention to the 4th one. There's 3 plans under the Medicare Savings Program. In order for someone to be eligible for it, you have to be below a certain income threshold to be eligible for that.
Okay.
And Medicaid then pays Part B premium on all 3, but they pay copays, coinsurance, deductibles, and guaranteed Part D extra help at certain levels for the other 2.
Mhm.
All right.
That's a question you probably want to talk to someone one-on-one about.
Yeah. Yeah. Most of these are going to be, by the way, because guess what? Everybody is an individual, right? And I do see that somebody put in the answer some ways for finding somebody answered finding the standards. Oh, no. Sorry, I'm going, I got lost.
Medicaid standard sheet.
No. They were talking about where to find benefits analysis. I don't know where the question just
Oh.
went. You all are typing so fast I can't read them.
I stopped.
I'm like, oh my God. I just want people to be able to see the answers. Somebody verbally tell, how do you find somebody that can help you with this one-to-one? Whoever just.
Your county
It
board.
was,
Paula.
Paula.
sorry, it was me. I typed the answer. So we did
That's
the whole
it.
benefit analysis training last year. So I posted the link to that. That's on YouTube. It's not yet on the Fear Factor website, but I'm sure it's going to get there soon. And then I just linked the WIPA project through Social Security. OOD does referrals and can do benefit analysis. And then also if somebody has a Medicaid waiver, home and community-based waiver, they can get it as a career planning service. So that is what I put on there. And some county boards have people on staff, like Latosha's from Warren County, Margaret's from Lucas County. Some of the bigger counties do, or has a contract with somebody who can do those services.
I see this from Donna Shackle.
Yeah, go ahead, Donna, or go ahead, Christine.
I did-
I'll read it and then
I
you can
can't
talk.
answer, but I know of somebody in this kind of situation.
I knew you were going to say that. So Donna writes about somebody who receives disability retirement through STRS, and she has Medicare and Medicaid. Her patient liability of more than $1,200 with a patient liability of more than $1,200 per month. She would like to reduce or eliminate this patient liability, but is concerned she receives too much from her gross STRS retirement to qualify for Medicaid buy-in. Is this true? So let's put this to a big one. I don't think we have any, I think this is true, right?
Ugh, that thing is complex. That's
Yeah,
why
that needs a one-on-one to get all the.
that needs a one-on-one.
Yeah, there could be some ways to help, but it is a gap in our services right now. It's a very tough one. Christine's been working very closely with somebody who's getting some significant retirement funds and having to make some pretty hard decisions about work with that. So know that is a tough one. I still would absolutely encourage, those are probably the most important people to get in with a benefits consultant to make sure they are accessing everything they can. Kat asked if someone makes too much but is placed in the Medicaid buy-in program, is it possible for JFS to request that the waiver ends or the person pay the $800 a month for them to keep the waiver? What if they qualify, then why would the waiver end is what
Well,
she's
if they're
saying.
not making their monthly payments of the premium, the waiver is going to end. The Medicaid.
It's really about the Medicaid ending. I mean, it's,
So if the
yes.
Medicaid ends, you lose your waiver too. So you have to keep your Medicaid up to date. But yes, if you have a premium buy-in, they're getting sticklers on if you don't make your monthly payments for your buy-in, they're gonna shut down your Medicaid and then you'll lose your waiver.
But the
We've
way
had
that,
that here in Medina County.
yeah, you're absolutely right, Kim. But the way that question is, it says, is it possible for JFS to request that the waiver ends? Well, they don't request that the waiver ends, but they will
Shut Medicaid
stop
off.
the eligibility for Medicaid, which will then stop the waiver eligibility.
Yeah, the wording is a little bit, but the bottom line is that, you know, yes, there is a point where the person will get notified that their Medicaid is being stopped, and that means that their waiver also. I will say counties have multiple different ways of dealing with that when that has happened. People have lost their waivers. County boards have paid the waiver, the patient liability for people while they're trying to figure that out. I don't know what else. Beg and plead, appeal. I don't know, whatever, whatever might happen. But yeah, that definitely people could lose a waiver if
Right.
they don't.
And where the confusion all rolls in is during COVID, they didn't have to pay it.
Right.
So all
Yep.
of a sudden now they have to pay it, and some families are like not understanding that, and they're not paying it, and then we're in jeopardize of losing our Medicaid and our waiver.
So Madeline, I'm going to go to your question, and I'm going to go back to what Christine had mentioned earlier. You were asking about, is there some way that you could put some money in stable from your paycheck and some money in? I'm assuming you're asking to get your income lower. And again, that was Christine's point earlier. It doesn't matter what you're doing with your income, whether you're putting it in stable, whether you're putting it under your bed, whether you're whether you are doing whatever, you are lighting it on fire. It's still countable. It doesn't matter. So, you know, that is not a way to get around. Stable does not protect your income.
But I can say if you, we could always use more cases for the case. So, I'll put my email in, okay? And
Yeah,
you could email me.
interestingly enough, now you can actually do direct deposit from work to stable now. I can guarantee you that they know exactly what's getting put in stable. So that is not going to be a way to hide money. It's used more for what you're spending your money on and being able to actually create some sort of a savings. That's the whole point of stable.
Protects assets, not income.
Thank you.
As
Those are
far
the
as
words.
income, if somebody's working, there's ways to, like, if there's impairment related work expenses or they're receiving a subsidy, but those are other topics. But that again, you have to sit down and look at the whole picture with somebody and explain it all to them and see how you can do things.
Which is the perfect segue to Trina's question, which is there a list of what is considered impairment related expenses? And number two, if an individual is no longer receiving SSDI due to going back to work, they are currently dual eligible. Does their Medicare ever stop? Oh, this is like 4 questions, Trina. Let's answer the first one first. Is there a list of impairment related expenses?
Yes, there is. So you can get it online. Social Security has what's called a red book. It's online. It's within that red book is a table that will give you examples of what is and what isn't an impairment related work expense.
I just pulled it up for someone today, so I will drop it in the chat. Like it's a condensed, take
Awesome.
it as a guide more, but yes.
Thanks, Jeannie.
Yeah.
And impairment related work expense, you have to pay it out of your own pocket. So it has to be related to work, like your transportation to work. So somebody helping you an hour in the morning or hour after work to get ready for work. Any kind of assisted tech you might need so you can do your job. It's all job related, and if you pay for it yourself.
There's actually other fear factor presentations that you can refer to, because this is kind of getting off topic from Medicaid.
Sorry, I got people asking me questions back here. So, all right, let's see what else we've got. I was gonna say, Trina, did you say, or I'm sorry, Darenda, did you say the SSDI stuff? The rest of Trina's question.
Oh, I didn't think, no, we were just talking about, Kim was going into it, which is awesome.
Yeah.
And I just said that's much more detailed than what we're talking about today. There's
Yeah.
other presentations that Fear Factor has given that they can go look at to get more defined information on IRWIs.
Yeah. And I think
that-
Tina's second question again is pretty specific, and also isn't that the next topic we're talking about is SSI,
Could
SSDI?
be SSI, SSDI, but it says
Yeah.
if an individual is no longer receiving SSI due to going back to work, that's a statement. Are they currently dual eligible? It depends.
We're gonna tell you to
don't
reach out
know.
separately. That's what
Reach
I'm gonna
out.
And if just real quick,
Call us
kind
up.
of answer that question. If a person stops receiving SSDI due to earnings and they were Medicare eligible, they can keep the Medicare eligibility for up to 8.5 years as long as they remain disabled per the original definition. But it's, again, a better one-on-one question.
Yeah, and again, remember, I know your questions, you guys are like, oh, these guys are answering all kinds of great questions. So we're really trying to keep it to the topics that we were discussing today, which is the Medicaid Buy-In, Workability, all that one waiver stuff. You got it. So we got Tanya saying, what happens when a provider, this is another patient liability, does not seek out getting the patient liability from an individual? They don't have that choice. That's my answer. They don't have that choice. And no, they can't just pretend to collect it, because that's your next question. I know that it's hard. So Britt, I'm putting Britt McGuire from Claremont on. You go ahead. I've had all these questions with Britt. Do poverty guidelines change every 3 months? Once a year?
Once a year.
Yay. See, I knew an answer. And I think your signal's going better. Can you take over? I have to do something in the house really quick. I'm being distracted.
Sure can. Am I live or am I delayed? Okay, whew, good. Sorry for that, everyone. So there was a question that I'm gonna say is really more a comment about every situation needs to be looked at differently, and I'm gonna and it included the webinar for where some of the benefits analysis information was. Gonna go ahead and dismiss that one. So Caitlin says, I had a situation arise where someone applied for SSI and appealed due to denial. Her husband makes $90,000 a year. Would this mean she would not qualify due to deeming?
Okay, so that's not a Medicaid buy-in question. That's more about SSI versus SSDI, and be glad to answer that offline or next presentation. We'll answer that as well.
Great. Next one. Who would we talk to one-on-one about SLMB? Help me out with that acronym.
Specified low-income Medicare beneficiary. It's one of the plans under Medicare Savings Program.
How it impacts long-term care. Oh,
Oh,
it moved on me.
I don't know where it went.
I got it. Paula answered and said Latosha would be a great person to answer that question. So
Fingers, Paula.
yeah.
Latosha, you're on the spot.
What's the question?
Who would we talk to about no, I lost the acronym that fast again.
Specified
SLMB, Specified Low-Income Medicare Beneficiary.
That is a Medicare
Specified
savings.
low income.
It's a Medicare savings program that pays for the Medicare Part B. Is that the question that needs to be
She wants to know that
I don't know what
the remainder of the
was.
question is how it impacts long-term care Medicaid. So they've talked with JFS, Ohio Department of Medicaid, and the Department of Developmental Disabilities, and feel like they're still getting the runaround. The provider has received denials for 2 months and no one is able to assist so far. So
Yeah.
looking for who to have maybe a more pointed conversation with, perhaps.
I feel like I know who this is, and we have been going around and around regarding this, but the Medicare savings program is not really connected to the waiver. If you're on a waiver, then you automatically get your Part B paid for, so you do get that benefit of being on a waiver and receiving that Part B. But I think the issue with this particular person is not connected to SLMB. I think there's a issue that is probably related to the waiver itself and not the Medicaid SLMB at all, because her Part B, the person that I'm thinking of, the Part B is being paid for by Medicaid, and Medicaid and Job and Family Services has indicated that her Medicaid benefits are active. So I think there's another issue that is very unclear to all the parties involved. So, but I'm constantly trying to figure out what we can do to help with this situation. But I keep coming up to the same thing, like it's not Medicaid, it's not JFS, because it's showing in the system that her Medicaid is active. But if it's who I'm thinking about, I'm still trying to find an answer for you guys.
I think it just points to how specific these can get, and that it really does need to be these one-on-one conversations.
I feel like there's a button that's not been, maybe a section on her services have not been checked, not the waiver, just in general. I don't know if it's on Medicaid's end or JFS end, but there's something very weird about this case.
Yeah.
More patient liability questions. So Valerie asked, an individual that we have now has patient liability, but is interested in Station MD, but the cost of the patient liability is significantly higher than the cost of the service monthly. How would this?
That's a whole other thing, because that's about patient liability for your services is different than that thing of Station MD would be covered under the healthcare assessment service, and is what it's supposed to be for the subscription. That's what I know.
Yeah, I think I think the question is more, will Station MD bill, the patient liability, and then saying that if that's the only service, again, we're going back to what services are being authorized on this case, Valerie. And so,
Have to do a different session on that kind of stuff.
Yeah, we're gonna keep working on that, Valerie. And Britt McGuire did put her name and I think her email, and I'll send you guys an email together, Valerie and Britt, to link you up. All right, contributions to an IRA can reduce countable income for Medicaid, correct? Who wants that one?
Oh.
So I would have to be honest with you, I'd have to go look at that one for sure. It might reduce countable income, but then it could also increase assets.
Well, I think it depends, Darenda, unless I'm wrong. What if they put the money in the IRA, but you can't get the IRA till you're 67?
So
you can't
again,
have access, okay? If you don't get access, it shouldn't be counted then, except we do know of a friend of mine who had a job and has an IRA from a previous employer, and because this person has an IRA from the previous employer, my friend can't benefit from Medicaid. He finds it out.
Right, again, so it's
case by case.
And only make a general statement there that typically 401ks or investments are counted as assets. There are some that are not, but you have to know the specifics of that investment to know whether it's counted or not.
Yeah, because if somebody's paying into like a 401k during their job, but they're not having access, I don't have an answer really, but
it depends. It depends. Again, it depends on what 401k, if they can take a loan from it or if they, can pull it out, right? If you have access to money that you can now take out, that becomes an asset. If you don't have access for a certain age, well, then it's not an asset until that age.
Right.
But you have to know the specifics of that certain investment before you can say whether it's an asset or not.
Yeah.
Makes sense.
I'm going to skip Megan's question real quick, and just because we are going to be
Paula put in about retirement accounts right here.
Oh, there you go. See, we're just constantly, I'm gonna first go to Krista's. Is there a list of medical expenses that a person can see to see if they are currently paying out to submit to JFS to help with current income guidelines? So I guess I'm at, is there, if they pay a lot of money for medical things, would that affect their income guidelines and eligibility for Medicaid?
Depends on what you're talking about. For waiver services, yes.
No, I'm looking at the last question. It's just about Medicaid.
Oh, just Medicaid.
Mm-hmm.
Well, I guess I would, that's a little confusing to me because
Okay.
why would you have, what would you be paying for?
Well, if somebody doesn't have Medicaid, they could be paying a lot of things.
Right, if they don't have the Medicaid.
That's what it's for eligibility of Medicaid.
And does that reduce countable income? Is that what they're wanting
Yes,
now?
that's what I think. I don't know that it does.
Are they talking about like IRWIs for the MBIWD premium?
I don't think so. Is there a list of medical expenses that a person can see to see if they are currently paying out to submit to JFS to help with current income guidelines for eligibility?
If it will reduce the countable income.
Yes.
That's what it is.
Yeah. I don't
know of a list.
I don't either. I thought it was an easy one. Sorry, my bad. All right. And then, sorry.
No, I was just gonna say in that situation, it might be best just to submit the information to JFS and ask them to review the case. It wouldn't hurt. And provide receipts for anything that you're paying on a monthly basis or a one-time expense.
Yeah, yeah.
Yeah, good choice.
I'm gonna have to say no, because I know in the past, now that until they did the Medicaid redesign, somebody could be over income limits and do a spend down. And spend down a certain amount of income and pay to their income too. They could spend it down and somebody would be able to get Medicaid eligible for that month if they spent so much money towards medical. But they changed that during the redesign. That was a little while ago.
Sounds like an interesting thing to look. You guys, it's always good to give us stuff to think about, but I don't, there's no easy answer. Certainly it's never going to hurt to provide more information to JFS. But there's no guarantee, there's definitely not a set list. We're going to transition back to our program. I do want to just say with Megan's question, about ideas, that people are over income for Medicaid, and are there any creative ideas to help with that? There's a million creative ideas, but we can't. That's not something. The bottom line is we have nothing to do with JFS and ODM and how to get Medicaid eligibility. So this is way too big of a group to talk about any of that. Certainly, I appreciate all the questions though, and lots of good ones. Yeah, I see Krista just kind of added like adult diapers. If you're spending a lot on adult diapers, would that be considered taking away from your income? All right, we're going to keep moving so that we can have our time up. Go ahead, Anne, if you can.
All right, I just couldn't get the mute button that time. So we normally will do a poll at the end of the session, but we are already ahead of ourselves and wanted to just give you the heads up to plan to tune in. A lot of you all had questions around SSI and SSDI, so please mark your calendar, April 30th, same time, 1 p.m. to 2:30 p.m. To tune in around SSI and SSDI, and specifically subsidies and work incentives. So I think a lot of the questions that were raised should be addressed in that next session. So thank you for your questions on it, though.
Yeah, that was a great.
And then just a final thank you.
Yeah, thanks for tuning in. And, I hope I don't want you to ever think that we're dismissive of your questions. It really just is so complicated and everything is so intertwined. And so we do have to break it off in chunks and learn. But just remember, do everything you can. If you can't find benefits analysis, work incentive practitioner, reach out to one of the ladies who shared their email, and they may have ideas in your area. They have access to lists and things like that too. They may not be able to help you, but they may be able to link you with somebody. Just a last reminder to tune in, or I'm sorry, look for your CPDU notification in your email in the next 48 hours if you are an SSA or a county board staff and you're looking for that. If you are not a county board staff, we are so thankful that you jumped on this meeting, and we would welcome any feedback from family members, providers, people with lived experience about how to make this information more accessible to you in both content and time and settings and where we could be doing this. So it's lots of good recordings on the Employment First website. Make sure you check that out. And we're probably still fine tuning a little bit on the PowerPoint, so that will also be available there very soon. And I think that's it, right? It is 2:26. Look at us. We're so good. Can't wait to see all of you too. And a great chat box. Thank you so much to all the panelists, and just a big shout out to our newer panelist, Kim Bernardi. Thank you so much for jumping in. I know that you're new to the group and you are presenting. That's a big move, so thank you. And then also we just another shout out again to Libby Grove and Margaret Zotkiewicz-Dramczyk for jumping in today and helping out with the panel. So we will see you all very soon in, what did we say? And is it March already or April? What was the date?
April 30th.
April 30th. All right. See you April 30th for SSI and SSDI. I'm sure I'll hear from lots of you. Talk to you all later. Bye-bye.